LEMS and MG, knowing the difference. Lambert-Eaton myasthenic syndrome, or LEMS, and myasthenia gravis, or MG, are similar conditions with similar symptoms. But there are differences between the two, including symptoms and how they are managed. How do LEMS and MG differ inside the body? Both LEMS and MG are autoimmune diseases, meaning a person's immune system attacks the body. For both LEMS and MG, this happens at the neuromuscular junction, or NMJ. This means that both are also neuromuscular diseases. In LEMS, the immune system attacks the nerve side of the NMJ. This makes it hard for nerves to send signals to the muscles to work. In MG, the immune system attacks the muscle side of the NMJ. This makes it hard for the muscles to receive the signals sent by the nerves. How do symptoms differ? Now that we know the difference in LEMS and MG at the NMJ, let's look at how their symptoms are different. The first symptoms of MG include drooping eyelids, double vision, and difficulty with speech or chewing. Usually, the first symptom for people with LEMS is weakness in proximal leg muscles, which include the hips and upper legs. Muscle weakness starts from the hips and spreads towards the head. In MG, weakness starts at the head and spreads downward toward the legs. In LEMS, muscle weakness is symmetric. That means it affects both sides of the body. In MG, muscle weakness affects one side of the body or the other. Another symptom that is different is tendon reflexes. People with LEMS have either no or very little tendon reflexes. People with MG do not lose their tendon reflexes. How about exercise? Exercising with LEMS temporarily improves muscle weakness. In MG, exercise makes the weakness worse. Lastly, people with LEMS experience dry mouth and dry eyes, while people with MG do not. Confirming a diagnosis through a blood test. A clinical way to get the right diagnosis is to test for antibodies. For most people with LEMS, a blood test will find voltage-gated calcium channel, or VGCC, antibodies. With MG, a blood test will find either acetylcholine receptor, or AChR, antibodies, or muscle-specific kinase, or MuSK antibodies. A small percentage of people with LEMS will not have VGCC antibodies. For these people, an electrodiagnostic test can help with making the diagnosis. In these tests, doctors measure how well muscles and nerves are communicating with each other. In short, a proper diagnosis can get you started on the right treatment program and help to improve your symptoms more quickly. If you are experiencing LEMS symptoms and have been diagnosed with some other condition, discuss your symptoms with your doctor. Ask for a VGCC antibody test. Take charge and learn more at lemsaware.com.